This is Health Matters, a podcast from Mayo Clinic where we discuss the latest medical advice, news, and research to help you live a happier and healthier life. My name is Kristen Meinzer. I'm a writer and journalist, and this episode, we're talking about dermatitis. The skin is the largest organ of the human body and also the most visible. That makes it extra frustrating when it gets red and itchy and you're not sure why or what to do about it. Could the cause of your mystery rash be dermatitis? And how often should you really be washing your skin? This episode, we're tackling these questions and more with Dr. Dawn Davis. She's a dermatologist and pediatrician at Mayo Clinic in Rochester, Minnesota, where she treats skin conditions of all shapes, sizes, colors, and locations. Dr. Davis is going to help us figure out how to tackle that stubborn case of dermatitis and maybe also take better care of all of our skin in the process. Dr. Dawn Davis, welcome to the show.
Thank you very much. Feel free to just call me Dawn.
All right, I will. But no, that seems weird. I've never called a doctor by their first name.
Well, feel free to call me Dr. Davis. It's totally fine.
Oh, okay. So we're here with you today to talk about dermatitis, but that's not a word most of us encounter every day. What exactly is dermatitis?
Derm means skin. Itis means inflammation. So dermatitis literally translates to inflammation of the skin. And there are innumerous forms of inflammation on the skin. Dermatitis is a general term, and then there are multiple subtypes of dermatitis. And it's not necessarily based on the location, it's based on the cause.
Let's get into some of those subtypes, starting with atopic dermatitis. What exactly is atopic dermatitis?
Atopic dermatitis, also known as eczema or eczema, is a form of dermatitis. It's the most common form in children and a very common form in adults. And it's one of the four, what I would call internal sensitivity diseases. So atopic or atopy is the concept of having internal immune system sensitivities that then cause your body to react internally to itself. So atopic dermatitis is sensitivity of the skin that causes irritation and inflammation. And so people who have an atopic disease have a couple of things in common. They have a barrier concern with regards to their skin. So children or adults with eczema have abnormal wall structure or skin cellular structure, if you will, that makes their skin vulnerable to the environment and then causes the immune system to attack the skin. So the analogy I give is that your skin should ideally be a brick wall with big, fat, plump cells full of healthy proteins that secrete glue to seal itself next to its neighbor, like bricks and mortar to make a wall. And people with atopic dermatitis have abnormal wall structure, making it more like a wicker basket.
Oh, I love that illustration. That makes so much sense. And you were saying this is an immune allergy system response eczema, aka atopic dermatitis. I do just want to mention a few other types of dermatitis, though, that I also hear sometimes thrown about. Contact dermatitis, seborrheic dermatitis, and irritant dermatitis. Are these different than eczema? Are they related?
They are different from atopic dermatitis. So they all have dermatitis in their name because they all have inflammation on the skin. But how or why they have inflammation of the skin is why they are different conditions and why they are different terms. But if you have atopic dermatitis, you're more likely to have contact dermatitis or irritant dermatitis. And then a lot of people can get seborrheic dermatitis.
So let's start with contact dermatitis.
Contact dermatitis, better known as allergic contact dermatitis, is a form of irritation on the skin that you get when the skin comes in contact to something that you are allergic to. The most common example would be poison ivy or poison oak or poison sumac. So if we have the rue oil from the plant on our skin, most people react to that oil because it's highly allergenic to humans, and then it causes our immune system to react. People can be allergic to gold or nickel, probably people with jewelry allergies or intolerance. People can be allergic to preservatives and cosmeceuticals, dyes, perfumes. You can actually be allergic to topical medications. And so if you have atopic dermatitis where your skin is broken open because it's not sealed correctly, you are more likely to get allergic contact dermatitis because your barrier of the skin wall is already compromised. So while everyone is theoretically at risk for allergic contact dermatitis, people with atopic dermatitis or eczema are more likely to be at risk for allergic contact dermatitis.
And then what about irritant dermatitis?
So irritant dermatitis is essentially where if you get something on the skin that's caustic in a particular dose or load, your skin will become inflamed. So for example, if I were to accidentally expose myself to bleach on my skin and I did that in a high concentration, my skin would react and become irritated and inflamed because it's caustic or dangerous to my skin.
Regardless of whether or not you have allergies or immune issues.
Correct. So irritant dermatitis can happen to anyone if the irritant is caustic enough to the skin. But people with eczema are more likely to get irritant contact dermatitis sooner because their barrier is already compromised. So for example, if I was a hockey player or if I was bike riding and I had protective pads on my elbows and knees, that friction from playing sports can give me an irritant or frictional dermatitis if I was working out and sweating really hard and not protecting my skin. But if I had eczema, I'd be more vulnerable to having that reaction sooner and with less activity.
And then what about seborrheic dermatitis? And what does seborrheic even mean?
Seborrhea means oil production. So our oil glands on the skin, most prominently on our scalp, secrete oil so that our hair doesn't turn brittle. And if our oil glands exude too much oil, then that can leave oil and scale on the scalp or wherever the seborrhea occurs. And then that being on the skin in excess can cause irritation. So people know seborrheic dermatitis more commonly as dandruff. And you can have dandruff not only on your scalp, but you can also have it along your eyebrows, in between your eyebrows. You can have it in your facial hair. And then a lot of individuals, particularly males, and the hair on the chest as they grow older can have seborrhea there as well.
So everyone can develop some form of dermatitis, but we know some people get it more than others. Do we know what makes some people more prone to developing dermatitis?
Genetics and environment can make us more or less vulnerable to various types of dermatitis. But there are other things that can make us vulnerable as well. For example, other medical conditions that we have, or our occupation or hobbies. So for example, if you're a hairdresser, you are more likely to develop allergic contact dermatitis to dyes because you are chronically exposed to dyes. Or if you're a dentist, you may have an increased risk of having allergens to antiseptics that are used in cleaning of dental instruments and antiseptics for the mouth. And so when we test people for allergens, we take a detailed social history and personal history so that way we can test specifically to the allergens for which they are exposed.
And if someone has a rash or skin irritation and they're trying to figure out what it is, what are some of the signs that it could be dermatitis?
Dermatitis tends to be red, and that is relative to the patient's baseline skin color or skin tone. So in someone who is quite pale, it could look very red. And in someone who has darker skin of color, it could look anywhere between dark brown to ashy gray or purple. So one disparity in healthcare with regards to skin disease is that it's oftentimes unappreciated or underappreciated that skin of color, when it is inflamed and, quote, red, is not classically red in persons of color. And so inflammation or redness is one sign. Atopic dermatitis tends to cause weeping or erosion of the skin because the barrier is broken down. So it might be wet or sticky. Sometimes there's crust or scale. And oftentimes dermatitis is itchy. because the nerves that are within the skin layers are irritated by the inflammation and the inflammatory cells that are there secreting their chemicals. So we kind of like to call it a red, itchy rash.
Got it. Now, maybe sometimes things present kind of like dermatitis, but actually aren't. Can you give examples of that and how one would know the difference?
Yes, absolutely. So multiple skin diseases can present with redness or color change, and multiple skin diseases can cause itch. But that doesn't necessarily mean that everything that is red and or itchy is dermatitis. For example, psoriasis, which is also an immune-mediated skin disease, can cause redness of the skin, and it can also cause scale. And specifically in children oftentimes, but sometimes in adults, can cause itching. But the reason that the skin is red, scaly, and itchy in atopic dermatitis is very different than in psoriasis. In psoriasis, the reason the skin is red is because when the immune system tries to attack the skin in psoriasis, the skin is genetically primed to overgrow like a callus to protect itself. And what happens is it's red because your skin normally grows, dies, and sheds in a 28-day cycle. But with psoriasis, the overgrowth is approximately once every 3 days. And you get scale because the skin can't die and detach that fast, so it's retained skin. And then when you have thicker skin that's dry and it's trying to detach, it gets kind of itchy.
So, dermatitis is a fancy term for skin inflammation. It's often itchy and some shade of red, depending on your baseline skin tone. However, there's more than one type of dermatitis, and these types have different causes. Atopic dermatitis, aka eczema, is when the body's immune system turns on the skin, causing it to become inflamed. Whereas contact dermatitis is caused by contact with something you're allergic to, like poison ivy. Similarly, irritant dermatitis happens when you get something caustic or irritating on your skin, like bleach. And lastly, seborrheic dermatitis, aka dandruff, happens when your glands overproduce oil, which sits on the skin and irritates it. While these types of dermatitis are distinct, if your skin barrier is already damaged from atopic dermatitis or eczema, you could be more likely to develop the other types of dermatitis. But if you have a rash that won't go away, how do you know what's causing it? And what should you do about it? We'll get into that next. So, when someone comes in with a rash, what kind of information are you gathering to help diagnose it?
It's very important to take a good history so that we can understand how long ago did you develop your skin problem? What parts of the skin are showing this rash and which parts are not? Is there anything recent in your personal life or in your health history that has changed that perhaps could serve as a trigger for this? And then what have you tried to do to alleviate the rash, and was it helpful or not? And using those clues along with the appearance of the rash, we can deduce what form of dermatitis it is. And if we're not quite sure, we can take a skin biopsy and look at the skin under the microscope, and it will tell us specific nuances as to which type of dermatitis it is. Once we know that, we can have targeted treatment against the cause.
Now, you were mentioning that sometimes patients will come in and they'll have already tried to treat themselves in certain ways at home. Are there products you do or don't recommend people use?
We typically do not recommend essential oils for soothing of the skin because essential oils can be allergenic or cause sensitivities, particularly in people who, one, have sensitive skin, or two, have their skin broken open and the skin wall is vulnerable. But you can do an over-the-counter hypoallergenic lotion or cream. You could do aloe, or you could do petroleum jelly. Petroleum jelly is hypoallergenic. It's natural and it's readily available. Some people like oatmeal baths to help with soaking. Or if you want to try something that's labeled more all natural, you could try purified coconut oil. Although oftentimes that's hard to find because a lot of the coconut oils that are available over the counter have a lot of perfumes and additives. So be very careful to find one that is as pure as possible.
At what point should somebody who is suffering from dermatitis actually just go to the doctor?
What I like to suggest is that sometimes your skin just gets exposed to something that it's irritated with, and it happens to be that you have a current environment circumstance. Maybe it's hot, maybe it's humid, or maybe it's dry and cold and windy, and your skin's just very vulnerable because the environment's not so great, and then you get exposed to something. And so you get this one-time limited irritation. And if you bathe gently and cleanse the skin with a mild cleanser once or twice a day, and then you moisturize with a hypoallergenic moisturizer twice a day, if you try that for 1 to 2 weeks and you feel like you're not making progress or improvement, then I would suggest that you seek consultation from a medical professional and, if possible, a dermatologist.
And then what is the doctor or dermatologist going to do for the patient at that point if they've already tried for 3 or 4 days to just be very gentle and to treat themselves at home?
So the dermatologist will take a history, trying to play detective, and take an examination of the skin. And they may not look just at the skin where the rash is involved. Oftentimes, dermatologists will look at other places to give them diagnostic clues, because it's just as helpful for us to know skin markers that show, are you sensitive or not? Do you have any other skin diseases maybe you didn't know you had? That gives us clues as well. And then we would make a diagnosis and then suggest prescription medications. And we may do advanced testing like a biopsy or patch testing, which is an allergy test to see if you have something specific that you're allergic to.
Would the medications be things like antibiotics, antihistamines, different allergy medicines? Because you were saying that eczema is essentially an allergy immune response. So is an allergy treatment the right treatment then?
That's what makes a lot of sense intuitively, but actually is not the case. So when we treat eczema, what we do is we do sensitive skincare to try to cleanse the skin and try to make the barrier wall as sturdy as possible. And then we try to remove irritants and allergens. So if there's something in your skincare hygiene routine that we could improve, we'll do that to decrease your risk of sensitivity. And then after that, we'll go with the inflammation. So if we can target the inflammatory cells that are sitting in the skin and causing the cascade of inflammation, if we can shut that down, then that alleviates the redness, the itch, and it allows the skin time to heal itself. And so oftentimes that's a topical steroid, or it might be a steroid-like medication that actually is steroid-free. So we have prescription medications that we can use. And if those do not work, we can progress to more advanced therapy, like we give phototherapy in the office, or we give systemic medicines by shot or by pill that can help decrease inflammation.
And after all that, can dermatitis actually be cured, or is this something that people at the most just hope to manage?
Some forms of dermatitis are episodic, meaning that there's a cause, you can alleviate it, and then it's finished. So for example, if I have allergic contact dermatitis to poison ivy, and then I don't get poison ivy anymore, then my episode will be done. Or if I have allergic contact dermatitis to nickel, and I treat my dermatitis and I avoid nickel jewelry in the future, then that would be considered episodic or cured. But a lot of the more sensitive diseases like seborrheic dermatitis, where the oil glands produce too much oil, or atopic dermatitis, where there's internal sensitivities, a lot of those are diseases that we control and not cure. Although, if you are a child, some children will outgrow their dermatitis fully, or it will lessen as the immune system matures. And then sometimes as adults become more senior, if their immune system becomes less exuberant, sometimes the dermatitis improves as well because the immune system's simply not as vigorous as it was.
Oh, that makes sense. Something to look forward to with aging, right?
Yeah, one positive. Although we need our immune system to work. We just need it to not be so hyperactive.
Yeah, it's trying so hard.
It's just doing its job. It's just working too hard. I call it eager beaver overachiever.
If you prefer to try to treat your rash at home, some reasonable things to try are a hypoallergenic lotion or cream like petroleum jelly, oatmeal baths, or purified coconut oil. You should bathe with a gentle cleanser once or twice a day and use hypoallergenic moisturizer twice daily. If you've tried this for 1 or 2 weeks and you're not seeing any improvement, then it might be time to see a dermatologist. They can offer more tools like allergy testing, strategies for sensitive skincare, and medications that can help reduce inflammation and give your skin a chance to heal. Whether or not you have dermatitis, it's important to keep your skin as healthy and non-irritated as possible. But there's so much conflicting advice out there to wash or not to wash. Use this cream or that product, but not this one. Let's find out what really works and what to skip in your skincare routine. All right, so we have to address the fact that there is a lot of conflicting advice out there when it comes to dermatitis. We hear some sources out there say, you just need to wash more often and more vigorously for dandruff or for different skin irritations. And some people say, no, you got to pull back and be gentle. Don't touch it, leave it alone. Who's right here?
Well, over time, we've learned a lot about bathing and hygiene. And you're right, different decades have shown different fads. So over my course of my career in medicine, we went from please don't bathe at all unless you absolutely have to. And I would have patients that were bathing once a month, and they were so crusty and scaly that their clothes would stick to them.
Oh. Poor things.
Well, no, you should live in bath water, and unless you have to go somewhere, you should be in a tub. And then people weren't getting out of their bathtubs unless they had to go to work and school.
Oof.
And as the phrase goes, everything in moderation. So what I suggest to my patients is you should take a daily bath or a shower using hypoallergenic products, and you should soak the skin as best as possible. Now, if you happen to have an activity for that day where you know that you will be dirty or sweaty or have a lot of friction, then you can either time your shower or bath to be immediately after that event. But if that's not possible, then what you should do is continue your daily routine of bathing and showering. And then you should also bathe or shower after the event where you are sweaty or have a lot of soil.
Is there a time limit to how long one should actually be in the shower, a temperature limit to the water? A lot of us like a nice hot shower. Is that something that should be avoided?
So I would say that you can make it warm, but not hot. So I want you to be comfortable. Mm-hmm. And if you are soaking in the shower or the tub, typically 10 to 15 minutes is enough. And then we all become wrinkly raisiny in the shower or the bath after that. So it's just enough to soak the skin, if you will. Another analogy I like to share with my patients is that ideally our skin would be like a brand new kitchen sponge. So when we go to the store and we buy a kitchen sponge and we take it out of the package, it's nice and plump and it's slightly moist and it has a lot of turgor or bounce. Mm-hmm. And if you leave it out on the counter for several days without touching it, it becomes kind of shriveled and dry and scratchy. And so healthy skin would be more like the new kitchen sponge, and dermatitic skin is more like the dry kitchen sponge. And so when we hydrate and cleanse our skin, we soak it in water, and it's like taking the kitchen sponge that's dry and shriveled and putting it in water. It immediately plumps up. And so part of the goal of bathing is to remove excess skin scale, excess oil, dirt, and microbes from the skin. But part of it is also hydrating the skin because the impaired barrier means that we lose more water out of our skin than we should. So bathing kind of helps us absorb back water we shouldn't have lost in the first place.
And then should we seal it all in with lotion or petroleum jelly?
That's exactly right. Yes. So once we hydrate and cleanse the skin, then in theory, our skin is more firm and has hydration and is clean. And so then we'd want to seal it like a greenhouse, if you will, by putting on a moisturizer that would serve as a barrier to water loss. So if you put petroleum jelly on your skin, that is essentially an oil product. and that helps delay loss of water. However, because it is oil, it usually doesn't soak into the skin. Or you could use a moisturizer that has some water loving and some oil components, such that some of it soaks into the skin and then some of it stays sealed on top.
One thing you mentioned earlier is there is the possibility that some of the lotions we're using might actually be what's causing the dermatitis. So how can we be sure that our lotion, or in some cases our cosmetics, aren't what's bringing on the symptoms in the first place?
So if you happen to notice that your rash gets irritated when you use the product, that could be just because your skin is raw, or it could be because your skin is trying to tell you that there's an active ingredient in there, or a preservative, or a perfume, or a dye it doesn't like. So the best thing you can do if you're worried that you have sensitive skin is to use products that are hypoallergenic. And the way that you know that is by making sure that when you read the back of the bottle, it has as few chemicals and ingredients as possible. So if you look at the jar of petroleum jelly and you look at the ingredients, it'll say petroleum jelly, or it will say water and petroleum jelly. That's as basic as it can get. Dermatologists have access to cream bases that have very low percentage of preservatives, and they tend to be hypoallergenic preservatives. So a lot of our patients who come to see us for dermatitis don't just get prescriptions for the active medications, but we also have compounded formulations where our active medications are put in bases that are hypoallergenic, and then we give patients prescriptions for hypoallergenic moisturizers.
So we don't have to just try and wing it by ourselves and just experiment like, oh, I'm going to try this lotion from the drugstore. You're saying a doctor can actually help with those formulations for us.
Absolutely. And when my patients come and we do patch testing, then let's say we find 3 allergens. What we do is we have a database where we input those 3 allergens. And in this database, we have the ingredients of thousands of cosmeceutical products, from shampoos to toothpaste to shaving lotions, etc. And then what we do is we input the allergens, and the computer base will push back to us a list of cosmeceuticals that do not have those allergens.
Oh, that's great.
So then you can go and say, okay, this is my grocery store list of possibilities. Here are the shampoos I can use that do not have my allergen.
Oh, I
so
love
instead
that.
of telling you what you're allergic to and saying good luck, that can be very, very overwhelming. What we try to do is empower you with a list of products that you can use.
Well, Dr. Davis, just to wrap up here, we know everybody wants perfect skin. What are some foundational habits or practices to protect our skin and prevent irritation that maybe we overlook, things that we should all be doing regardless of whether or not we feel that we're at risk for dermatitis?
So we can all practice sensitive skincare, and that will help all of us have healthier skin and healthier looking skin, which is usually a goal for most people. Sometimes we don't like to hear this advice, but it's important nonetheless. So firstly, we should wash our skin once a day and use a gentle cleanser and moisturize. So the whole body, bathe or shower once a day. And then if you are sensitive skinned or you're getting soiled or dirty or sweaty, then it would be twice if you can't time your bath or shower to the event that's going to cause the soiling and sweat. However, you should wash your hands, of course, obviously multiple times a day with eating and things like that. But if we're talking about just skin hygiene, we should wash our face twice a day. So you should wash it once a day in your bath or shower, which is usually in the morning or before bedtime. And then the other time of day, you would wash your face again. So what I say is every time you're brushing your teeth, you should also be washing your face. Now, if you happen to be also doing something that causes dirt or sweat in the middle of the day, you're going to end up washing your face 3 times a day. But ideally, you would wash your face twice a day with a gentle cleanser and then use a hypoallergenic moisturizer. So in addition to that, we like using moisturizer. So for the body, that would be a minimum of once a day. But if you have sensitive skin, twice a day. And then the face is wash and moisturize twice a day. And then, of course, avoid smoking and avoid secondhand smoke. And limit sun exposure, or if you are out in the sun, make sure that you're wearing photoprotective clothing, hats and sunglasses. Make sure that the sunglasses are broad spectrum so that they get all forms of UV light. And then I recommend that you wear sunscreen on your exposed body parts like your face, your neck, and the back of your hands during the day. So I wear an SPF 30 when I'm indoors on my face, neck, and hands. And then when I'm outdoors, an SPF 50. And I would encourage that at a minimum, you wear an SPF 15 when you're indoors and 30 when you're outdoors.
Dr. Dawn Davis, this has been so great. Thank you so much for your time today.
Thank you for having me. This has been really fun.
I learned so much, and I have so much compassion for my hardworking immune system.
That's right.
If you want healthy-looking skin, just about everyone can benefit from sensitive skincare practices. That means washing your body at least once a day, your face twice a day, and of course, your hands as needed for hygiene. For a full body wash, 10 to 15 minutes at a warm temperature should be enough to keep your skin plump and moist. After washing, you should also moisturize using a hypoallergenic moisturizer, which means something with as few ingredients or chemicals as possible. And if you know you're going to get dirty or sweaty during the day, try to time your bath or shower immediately afterwards. Or if you can't, add an extra wash into your routine. Our skin is such a hardworking organ, protecting our body from the outside world. It's understandable that it gets irritation from time to time. But with some hard work and persistence, we can heal and protect our skin to return the favor. Okay, that's all for this episode. But if you've got a question, a topic suggestion, or a follow-up question about this episode, you can leave us a voicemail at 507-538-6272. We might even feature your voice on the show. For more Health Matters episodes and resources, head to mayoclinic.org/healthmatters. And if you found this show helpful, please subscribe and make sure to rate and review us in your podcast app. It really does help others find the show. Thanks for listening, and until next time, take care and stay healthy. This podcast is for informational purposes only and should not be relied upon as medical or legal advice. Always consult with a qualified healthcare provider for any medical questions. The appearance of any guest does not imply an endorsement of them, their employer, or any entity they represent. The views and opinions are those of the speakers and do not necessarily reflect the views of Mayo Clinic. Reference to any product, service, or entity does not constitute an endorsement of or recommendation by Mayo Clinic.